Welcome to the deep dive. Today we're tuning into the electrical activity of the heart, specifically looking at something called first-degree atrioventricular block.
Yeah, AV block sounds pretty technical, right?
It does,
Yeah.
but basically think of it like a little delay, maybe a slight hiccup, in the signals that travel between the heart's upper chambers, the atria.
And the lower ones, the ventricles, the main pumping chambers.
Exactly. And we've got some interesting material from a medical text to really help us unpack this.
Right. Our mission today is really to get a handle on what this first degree AV block actually is, what might cause it.
And, why it might be more relevant than you'd initially think.
And one of the most surprising things, I think,
Mm.
is that even though it involves the heart's electrical system, it often shows, well, no outward signs at all.
Totally silent sometimes. It's like this hidden electrical event, which makes it, I don't know, kind of fascinating to understand. So where do we start? Maybe with the ECG.
Good idea. The electrocardiogram. So normally you expect a nice, steady rhythm on an ECG printout.
All right, the regular heartbeat.
And with first-degree AV block, you usually still have that. The overall rhythm is typically regular. You still see the normal P waves, which show the atria firing.
And the QRS complexes showing the ventricles contracting. Those look okay.
Yep, they look normal. But the clue, the key indicator, is the PR interval.
Yes. Explain that bit.
So the PR interval measures the time it takes for that electrical signal to get from the atria through the AV node junction and down to the ventricles to tell them to beat.
Got it. Like the travel time for the message.
Exactly. And in first-degree AV block, that travel time, that PR interval, is consistently just a little bit too long.
Okay, and there are specific numbers for that.
There are. For dogs, we're looking at anything over 0.13 seconds. And for cats, it's a bit shorter, anything over 0.09 seconds.
And it's consistently long, right? Not just an occasional blip.
Precisely. Consistently prolonged. And another interesting point, normally, that PR interval should actually get shorter when the heart speeds up.
Oh, right. Like the system gets more efficient under pressure.
Kind of. So seeing it stay long, even with a faster heart rate, is another piece of the puzzle.
Okay, so that's what it looks like in the ECG strip. But physiologically, what's actually going on inside the hearts to cause this slowdown?
Well, here's that surprising fact again. First-degree AV block itself, on its own, it basically never causes any clinical signs. Your pet won't feel sick just because of this.
But you wouldn't notice anything different about them.
Not usually, no. However, and this is important, it can sometimes be an early warning sign.
Ah, okay. A sign of what?
That maybe, down the line, more serious issues with the heart's electrical conduction could develop. So while it's often harmless, it's something a vet might want to monitor.
Right. Potential heads up. So where exactly is this delay happening?
It could be a couple of spots. Sometimes the slowdown is happening as the signal travels within the upper chambers, the atria themselves. That's called intra-atrial conduction delay.
Okay.
Or, more commonly perhaps, the delay happens right at that critical junction box, the AV node.
The relay station between the top and bottom chambers. Like a little traffic jam there.
Exactly like that.
So who gets this? Is it common in certain pets?
We definitely see it in both dogs and cats, but yeah, there seem to be some breed predispositions.
Oh, like which ones?
Well, in dogs, American Cocker Spaniels and Dachshunds pop up quite a bit. Also, those brachycephalic breeds.
The short-nosed ones? Pugs, Frenchies?
Exactly. They seem to be more prone to it. And over in the cat world, Persian cats are mentioned more often.
Interesting. Any idea why those breeds? Genetics, maybe?
It could be genetic or perhaps related to shared physiological traits, like maybe higher baseline vagal tone in some of those breeds. It's something researchers are still looking into.
Okay, good to know, especially if you happen to have one of those breeds. What about age? Does that play a role?
It can, yeah. We sometimes see it in young, healthy dogs, and in those cases, it's often linked to what's called high vagal tone.
The vagus nerve.
Mm.
That's one that kind of calms things down, right?
Spot on. It's part of the parasympathetic nervous system, the rest and digest system. High activity can slow the heart rate and the signal conduction.
Okay. And in older pets?
In older dogs, especially those predisposed breeds like Cockers and Dachshunds, it might be due to degenerative changes, sort of wear and tear on the heart's electrical wiring over time.
Makes sense.
And for Persian cats, it's interesting it can show up at any age. Again, maybe high vagal tone, or sometimes it's associated with a heart condition called hypertrophic cardiomyopathy, or HCM.
Right, where the heart muscle gets thicker.
Exactly, and that thickening can sometimes physically interfere with the electrical pathways.
So we know who might get it, but let's circle back to the signs, or lack thereof. You said mostly asymptomatic.
That's the main takeaway, really. Most animals show zero signs. It's typically an incidental finding. The vet does an ECG for some other reason, maybe a pre-anesthetic screen, and spots it.
Okay. But the text mentioned something about drugs causing it. Could that lead to signs?
Ah, good point. Yes. If the first-degree AV block is being caused by medication, then you might see signs. But those signs would likely be related to the drug itself, not the AV block.
Can you give an example?
Sure. Like, if a dog is on too high a dose of digoxin, a heart medication, you might see things like poor appetite, vomiting, or diarrhea. That's digoxin toxicity causing issues, and the AV block is just one part of that picture.
Okay. Or maybe weakness with other drugs.
Right, like certain beta blockers or calcium channel blockers, if they're affecting blood pressure or heart function significantly, you might see weakness. It really highlights why telling your vet everything your pet takes is so crucial.
Absolutely. And what about during the physical exam? Can the vet hear anything unusual with a stethoscope?
Generally, no. The heart sounds are usually normal with just first-degree AV block. Now, if there's an underlying heart condition causing the block, like HCM, then the vet might hear a murmur or other abnormal sounds related to that condition.
But the block itself is usually silent.
Pretty much, it's an electrical finding more than a physical one.
So let's dig into the causes a bit more. We've touched on a few, but what's the full range?
Well, like we said, it can just happen. In perfectly normal, healthy animals, especially young athletic ones, sometimes that high vagal tone is just their normal state.
Okay.
Then there's increased vagal stimulation because of some other non-cardiac problem. Things like respiratory issues, gastrointestinal disease, even eye problems can sometimes ramp up vagal tone.
Really? Wow. And you'd see other ECG changes then, too.
Often, yes. You might see sinus arrhythmia, that normal speeding up and slowing down with breathing or even short pauses, along with the first-degree AV block.
And then there's that list of medications. It seemed quite long.
It is pretty expensive. We mentioned digoxin, beta blockers, calcium channel blockers,
Right.
but also antiarrhythmics like propafenone and amiodarone. Even certain sedatives, the alpha-2 agonists, can do it.
Okay.
And then there are drugs that directly stimulate that vagal effect, parasympathomimetics like bethanechol, phesostigmine, pilocarpine.
Used for various things like bladder issues or eye conditions sometimes.
Exactly. And even getting toxicity from older heart drugs like procainamide or quinidine could potentially cause it.
Mhm.
So yeah, medication history is key.
Definitely sounds like it.
What
What else?
We talked about the degenerative changes in older dogs.
Yeah, the wear and tear.
Hypertrophic cardiomyopathy, especially in cats, and then myocarditis, inflammation of the heart muscle itself.
Caused by infections.
Right. Things like Chagas disease from Trypanosoma cruzi, Lyme disease from Borrelia burgdorferi, or even Rocky Mountain spotted fever from rickettsii.
So infections can directly impact the heart's wiring.
They can. Also, infiltrative diseases, think tumors infiltrating the heart muscle, or amyloidosis, where abnormal proteins deposit. Anything disrupting the tissue can disrupt the signals.
Okay.
And here's a weird one. Sometimes giving intravenous atropine, which we usually use to speed up the heart,
Yeah.
can actually, briefly, make the PR interval longer in some animals before it speeds things up. A little paradoxical effect.
Huh. That is surprising. So summing up the risk factors, it really seems to be anything that boosts that vagal nerve activity.
That's a big part of it, yes. Either directly via drugs or indirectly via other diseases stimulating the vagus nerve, or, of course, having underlying heart disease itself.
Okay. So how do vets nail the diagnosis, given it's often silent?
Well, the ECG is the cornerstone. Seeing that consistently prolonged PR interval is the definition, really.
But you mentioned it needs careful interpretation.
Yes, because sometimes, especially if the heart rate is fast or the PR interval is very long, the P wave from the next beat can land right on top of the T wave of the previous beat.
Making it look like a weird two-wave instead of a P-wave plus a delay.
Exactly. So you have to look closely at the timing and morphology. The text actually has some good examples comparing first-degree AV block with things like notched T waves.
Gotcha. What about other tests besides the ECG?
Definitely. Blood tests are usually a good idea. Checking electrolytes, particularly potassium, is important.
Why potassium?
Both low potassium, hypokalemia, and high potassium, hyperkalemia, can affect the heart's electrical stability and potentially contribute to or worsen conduction issues.
Okay.
A complete blood count, a CBC, might show signs of infection if myocarditis is suspected. And biochemistry profiles look at organ function. Your analysis gives more clues.
And specific tests if you suspect something particular.
For sure. If the pet's on digoxin, you might check the drug level in the blood. If you suspect Lyme or other infectious causes, you'd run titers or specific tests for those agents.
Makes sense. And thyroid levels in cats.
Yes, checking T4 is important, cats, as hyperthyroidism can have various effects on the heart, though it's not a classic direct cause of first-degree AV block typically. Still good to rule out.
What about seeing the heart itself? Imaging.
Absolutely. An echocardiogram, the heart ultrasound, is really valuable.
What does that show?
It lets you look for underlying structural problems. Is there HCM? Are there signs of infiltrative disease? Is the heart muscle inflamed? It helps identify or rule out many of the underlying cardiac causes.
And sometimes you need to look beyond the heart.
Right. If you suspect high vagal tone due to a non-cardiac issue, you might need to investigate further. Maybe chest x-rays to look for masses, an upper airway exam, checks for GI problems, even measuring eye pressure if glaucoma is suspected.
Wow, it can really connect to a lot of different systems. And pathologically, if you were to look at the heart tissue.
It really depends on the cause. If it's just high vagal tone in a healthy heart, the tissue might look completely normal. If it's myocarditis, you'd see inflammation. If it's degeneration, you might see fibrosis in the conduction system. The pathology reflects the underlying disease.
Okay, so let's shift to treatment. How do you manage first-degree AV block?
The absolute key is you treat the underlying cause.
So you don't treat the block itself.
Generally, no. If it's caused by a drug, you stop the drug or adjust the dose if possible. If it's caused by Lyme disease, you treat the Lyme disease. If it's HCM, you manage the HCM.
So the focus is elsewhere.
Entirely. Sometimes the pet might need hospitalization, but that's usually for managing the primary problem, not the AV block specifically.
And what about things like exercise or diet? Any restrictions just for the block?
Nope. Unless restrictions are needed for the underlying condition, the first-degree AV block itself doesn't require any changes to activity or diet.
And educating owners. Is that a big part?
Usually not necessary for the block itself, simply because it's almost always asymptomatic.
Yeah.
The education focuses on whatever primary disease is present. And surgery. Definitely not indicated for just first-degree AV block.
Okay. Now, what about medications used for those underlying conditions? Any pitfalls there?
Yes, definitely things to be aware of. You want to avoid making things worse. For instance, maintaining normal potassium levels is important, so avoiding situations or drugs that cause hypokalemia is wise.
Right, because low potassium can worsen conduction.
Exactly. And you also have to be cautious with or potentially avoid drugs that are known to slow down conduction through the AV node even further.
Like which ones again?
The list we mentioned earlier: calcium channel blockers, beta blockers, those alpha-2 agonists, amiodarone, propafenone. If you add those on top of an existing delay, you risk progressing to more severe block.
Okay, so those are generally contraindicated or used with extreme caution.
Right. And then there are drugs that, while may be necessary, need careful monitoring because they have that vagal mimicking effect.
The vagomimetic ones.
Yeah, like digoxin, bethanical, physostigmine, pilocarpine. They can worsen the block, so if they're essential, you'd likely want to monitor with follow-up ECGs.
Which brings us to follow-up. What's typically recommended?
Unless it's seen in a young, healthy animal where it's likely just high vagal tone and considered benign,
Yeah.
ECG monitoring is generally a good idea. Maybe periodically, maybe more often, depending on the situation and the underlying cause.
And the goal is to watch for.
To see if it's stable or if it's progressing. Is that PR interval getting longer? Are we starting to see dropped beats, which would indicate progression to second-degree AV block?
Okay, so monitoring for worsening. Is there any way to prevent first-degree AV block?
Not directly, really. Since it's often secondary to something else, prevention boils down to managing those underlying risks. Good general health care, appropriate medication use under vet guidance, prompt treatment of infections, that sort of thing.
Right. General good practice.
It really comes back to that close relationship and open communication with your vet.
And what about complications from the first-degree AV block itself?
Again, usually none.
Ah,
Because it doesn't cause symptoms, it doesn't typically lead to direct complications on its own. The complications, if any, would come from the underlying disease process.
so putting it all together, what's the bottom line? The expected course, the prognosis?
It hinges entirely on the underlying cause. If there's no significant heart disease or other serious condition found, and it's just an incidental ECG finding, then the prognosis is generally excellent. It's often just a little electrical quirk that doesn't impact the pet's life or health. If there is a significant underlying cause, then the prognosis depends on how manageable that condition is.
Okay, that makes perfect sense. So wrapping up this deep dive, it seems first-degree AV block is
hmm
kind of like a quiet signal from the heart, a slight delay.
Often completely harmless in itself, but sometimes acting as a clue, pointing towards something else happening, whether it's medication effects, another illness, or just the body's own nervous system balance.
Yeah, and it's pretty surprising, isn't it, that something so common can be so silent and linked to such a wide variety of factors.
It really is, from drugs to infections to just, well, high vagal tone.
It kind of makes you pause and think, doesn't it,
Yeah.
about how these subtle variations inside the body, these tiny shifts in timing, like this electrical delay, can sometimes be whispering important information about bigger processes going on under the surface. Understanding these quiet signals, well, it seems crucial, not just in heart health, but maybe in understanding complex systems generally. A reminder that sometimes the smallest details hold the key.
Well said. It's about listening closely even to the silent signals.
Absolutely. Thanks for joining us for this deep dive.